All right, we're here. Special kind of episode today. We don't get to do these ones too often, so very appreciative of the time. I will be having Jeff Stotts on the show. We're going to talk about some NBA injuries, focusing on soft tissue injuries, calves, groins, hamstrings. We hear all about those these days, as well as just some knee stuff, meniscus injuries. Domantas Sabonis recently obviously ruled out for a month-ish due to a meniscus injury. Welcome to Stuff It, a fantasy basketball podcast, brought to you as always by FanDuel and part of the Old Man Squad Network. Please go and subscribe on the YouTube channel and download the audio versions as well. Let's get Jeff straight in. He's a busy man. I don't want to keep him too long. Jeff, thanks for making some time to come on the show.
Appreciate you having me on as always, man. Always love talking hoops.
So we're going to talk about injuries. I can see a friend behind you there. Well, look, we'll start with the soft tissue injuries, I think. But I was obviously I do follow you on Twitter, and other people should as well. At In Street Clothes is where they can find your stuff, and you've got sort of a rolling weekly update of injuries, and yeah, I mean it's always interesting reading, but I guess for me or for other people reading through it, they may not, like, they'll look at those numbers and say that's a lot, but is it a lot? I feel like every year we talk about different injuries, and man, I mean, I hear it all the time from fantasy managers. My team is decimated. I've had so many missed games. Is there an increase this year in soft tissue injury, I guess, broadly speaking, compared to previous years?
Well, we're about the same over the last 5 years, and really kind of, I've been tracking injuries for a long time in the NBA, and we've always had a spike in soft tissue injuries in the first quarter, first 20 games of the season. That's kind of always how it's been, coming into preseason and coming out of preseason into those first 20 games of the regular season. Generally speaking, we see that's the time frame where we see the most hamstring strains, calf strains. We tend to see a spike in ankle sprains, those kinds of things. As we enter the year, it's not surprising given we go from off season to moving, and the soft tissue is vulnerable to injury at these points of the season. We also then see a little bit of a dip as the year goes on, and then we kind of get a spike as the year ends, as fatigue starts to kick in, or teams start to kind of going okay, we know who we are, let's start shutting some guys down and those kinds of things. But we've always had that spike, but the last 5 years it's been particularly high, as we've come out of COVID in that truncated season where we adjusted for COVID as well. So, I think to an extent we're still feeling a little bit of the ripple effects of the pandemic and what that meant to the change in the schedule, what it meant to the change in the global schedule for off seasons and things like that. And so I think we're going to continue to see that for a little while. I wouldn't say it's completely the fault of COVID, because it's always been a spike. But the last several years, we've seen a significant increase in terms of just total games lost in general. It's all kind of gradually increased. So looking at the numbers, we're through 5 weeks now. We're on a Monday, so we've completed 5 weeks of the season. We're at about 20% of the regular season. I'll get a better idea of exactly where we are when 20 games have been played, because then everyone's played the same number of games. Everyone's schedule is the same. Like Houston has not played as many games as some of the other teams. So you'll see a better balance and get a better insight as to what exactly is going after true 20 games played. But looking at the numbers right now, we're at roughly almost 1,300 games lost, which is up from last year, which was just over 1,200 games lost. But the proportions are roughly the same. So we're looking at about 29% of those games lost due to muscle-related injuries, about a third of those games lost due to ligamentous injuries, so sprains. And then last year was about the same. So it was actually just kind of inverted. So we had more more muscle injuries last year versus ligament injuries. But I kind of knew we were going to get that, given that we've got Tyrese Halliburton, Jason Tatum, Damian Lillard coming off those Achilles tears that we saw at the end of the year. We knew those numbers were going to be up going into the year, because we're expecting those guys to miss significant portions of the season, if not all of the season. And then, we have had what appears to be a increase in calf and Achilles related injuries. Last week, I believe I tweeted something out. Hey, it looks like they're proportional. But since I tweeted that out, we've had 3 or 4 more calf injuries pop up. Shane Sharp, a couple other guys starting to miss with like calf soreness or calf tightness. And so maybe we are seeing a little increase in calf related injuries, but it's not necessarily something that's drastically different than the last 5 years.
And look, I guess a question that, it's sort of different over here. I guess if we look at sport here in Australia compared to in the States, most of our leagues, whatever sport it is, it's weekly. So it's more like the NFL where you have 1 game a week. Our basketball league here, the teams maybe have 2. That's sort of the most. They would have 2 in a week. I don't think it's rarely that it's 3. In the NBA, obviously, it's 3 or 4 usually. So the load, like they're playing a lot more. In terms of recovery from a calf injury, so someone, I know there's different grades. So there's grade 1, 2, and 3. It feels to me as though certain players are rushed back from these injuries, but maybe now teams are starting to take more of a cautious approach. And I guess Anthony Davis comes to mind. So he obviously injured his calf very early in the season. I think he only played about a week, 5 games, something like that. He was sort of ruled out a couple of weeks. Then he was trending towards coming back. He was. I think he was even questionable, maybe for 1 or 2 games. Then they had the whole Nico Harrison. He left, and then things changed up a bit. And I remember reading stuff about Nico was trying to force him to come back, where he wasn't ready. He then was ruled out for another 7 to 10 days. And then today, I think he's been, I guess, upgraded to doubtful. So that would indicate that he's potentially coming back this week at some point. In your mind, is that sort of something that happens in the NBA because of the load and the amount of games? Are players rushing back from these injuries? Because we've seen certain players aggravate these injuries. Jalen Green was a good example early in the season. But so is that something that happens or not really?
Well, I think there's a couple things that go into it. Number one, there's a lot of degree of variability in the recovery from the calf strain. So what I have to remind people is the calf is not an isolated muscle. It's a muscle complex. And so location matters with those strains. Is it in the soleus, which is the deeper portion of the calf, or is it in the gastrocnemius, which is the bigger 2-headed, meatier, more superficial part of the muscle? Is it a strain actually in the Achilles? So we really have to determine on what's going on. That's where we talk about things like grades. So the average time loss of most just generic calf strains, where we don't necessarily have a true grade. So any calf strain that resulted in time lost, you're looking at about 20 days. So looking at roughly 3 weeks. Mm-hmm. However, looking at those cases, about 1 in 3 of those cases is going to miss more than 20 games. And 1 in 5 of those cases is going to miss more than 30 days. So you can see there's a kind of pretty good degree of variability in those cases. And again, it does matter where the tear or the strain occurs. If it occurs in the muscle belly, in the tendon, you can see in the image here the various locations of potential injuries. Now, it also depends on the player. And the other thing I want to point out, and this maybe links back into AD and maybe some of the other cases we're seeing like Jalen Green, is the calf and the hamstring are injuries that are prone to setbacks or re-injury. The re-injury rate is particularly high. So if these muscles don't adequately heal, the likelihood of aggravation or re-injury is relatively high. Even if it does heal completely, there is a relatively high re-injury rate there as well. So you kind of have to find this very delicate balance of, is the player ready? Are we meeting all our check marks? Are they functionally good? Do they have full range of motion? And every team that kind of has a different approach of what that's going to look like. Do they meet a strength training? Have we actually measured tendon strength? That were we doing ultrasound images of tendons? Do we see any alteration in the tendon? All these things can kind of come into play. Then you can throw in the subjective factor of it. Does the player feel ready to play? How are they feeling? What do they say? Because yes, the tendons, the muscle may look good. They're meeting all the check marks and benchmarkers to return to play. But if they still don't feel right, you shouldn't let them back into the game. You know what I mean? So it's this very, very delicate balance that we find here. So it's not as simple as people want to make it out. I also think the big problem this year is we've had a lot of guys, maybe start to be a little cautious given what we've seen, and maybe some teams are gun shy after what we've seen with Tatum and Halliburton and Lillard. Now, again, I do want to caution and say, looking through the data, there aren't a ton of guys that have suffered calf strains and then immediately come back and torn their Achilles. The only two I can think of are Durant and Halliburton.
Yeah.
That doesn't mean there weren't other injuries in their injury profile that might have increased their risk of a tear. But, I've documented over 400 calf strains. It doesn't mean I've then had, 400 Achilles tears. We've only had a very, very, very small percentage. One of the things that might actually be more relevant to players coming back from injury is maybe if they had a previous Achilles injury, like a tendinopathy or a tendinitis, and that the percentages there seem to be a little bit higher because that directly involves the Achilles. Still, I think it would be unwise to say it's completely unaffecting the kinetic chain and increasing and influencing the odds of an Achilles issue. But I don't think it's necessarily as high as some people want to make it. And maybe we are being extra cautious. But at this point, given the salary dollars of some of these guys, being cautious and preventative is the right approach to take.
Yeah, and I recall, I think when again, going back to Anthony Davis, when he was sort of, it looked like he was coming back and then obviously shifted in the other direction. I think some words came out from the Pelicans along the lines of we're waiting for scans. They're doing scans to have a look at to limit the chances of a further injury kind of thing. So I'm assuming that's something all teams would do, as you've sort of alluded to. They would be doing scans and things like that of the muscles. With these injuries, and I guess hamstrings more come to mind for this discussion. Once you've had a hamstring injury, does the rate, I mean, you've said the rate of re-injuring it sort of goes up a little bit, but in terms of it being long-term, I'm thinking years, and I'm thinking Zion Williamson here, who seemingly has had hamstring injuries for the last 1-2 years. Cam Thomas had, I want to say 2 or 3 last year, and he's already out for 6 weeks this year. Now, and obviously, I guess with the Cam Thomas one, he had a full off-season. The Nets did not play postseason basketball or anything like that. So he had months to recover this or sort of rehab this thing and was seemingly good to go, and then did his hamstring again. Once a player suffers an injury like this, are they more prone to it just hanging around, or is it just sort of a little bit of luck, I suppose?
It's a little bit of both. I'd even throw Aaron Gordon into that mix as well. Remember, he had the hamstring strain that he played through in the postseason, and then now he's shelved with a grade 2 hamstring strain. There are so many factors that come into play with injuries. Number one, is there some underlying factor that is contributing to the strain? Is it biomechanics? Is it style of play? Is it the shape of the foot? Is it the footwear? All these things can come into play. It's a little bit of everything. When we talk about injuries, there is no cure for injuries. There's nothing that's going to completely reduce a player's risk of suffering some kind of injury other than not playing, right? Like that's the only way to potentially avoid injury. So we're kind of in the business of risk mitigation, right? Like, so determining how do we minimize risk as much as we can. And for certain players, that risk is going to just inherently be a little bit higher. Now, the biggest predicator for a future hamstring injury is a previous hamstring injury. Studies have shown that. And part of that reason is because of the delicate balance of which the healing occurs. So when the strain occurs and that muscle tendon or the muscle tissue is damaged, whether it's a partial tear, like a grade 2 strain, or even just a micro strain, grade 1 micro tearing of the mini fibers, that tissue needs to be repaired. And it does so our body does not do so in a very organized way. It does so in a very haphazard way. It kind of just fills in the gaps. I always kind of tell people, if I punch a hole in a wall, I'm going to want to try to go back and reinforce that hole so it doesn't fold, instead of just throwing a bunch of spackle on there or even paper and then just kind of cover it. Where our body just kind of fills the gaps. It doesn't necessarily lay things down in alignment. It's just trying to repair the gap. That's where a good physical therapist, a good athletic trainer, a good physiotherapist, anybody that's coming in and doing work is going to to do things that's going to help facilitate the healing process, to promote it, but also make sure that it's doing so in an organized fashion. And the tricky thing with hamstrings is the injury can start to feel good. The injury site can start to feel good. The player might start to report, hey, I'm functionally feeling good, but the scar tissue that's been laid down does not have the full strength as that original tissue. So it's easily disrupted, it's easily aggravated, and or a strain somewhere else along the kinetic chain can occur. So it takes time. It's a very delicate process to ensure that the healing process is carried out in the most appropriate fashion, but then has given enough and allotted enough time to fully return to as close to full strength as possible. And that's where it can be very, very tricky, because they can be meeting all the markers and feel good, but they're still at an increased risk for another injury.
Yeah, and I guess it's such an explosive sport as well, isn't it? And it's having played for years, it's so hard to simulate a game in any sort of make-believe situation like training, because a game is just so reactive, and it's not a planned. No moves are planned. Everything is, you're doing what the defense allows you to do, and all sorts of things. So a lot of variables when you're coming back from these injuries. So we'll shift into knee injuries. I'll just do the quick ad read. Have to do this and keep the partners happy. So a reminder that today's episode is brought to you by FanDuel. Head to the website, sportsbook.fanduel.com. All of the in-season betting, in-game betting. No games on at the moment, but when they're on, you can jump in there and also have a look at all the futures, all the award winners, MVP, Rookie of the Year, Most Improved Player, everything is there. Sportsbook.fanduel.com is the website. There's a bit of a transition here. So when I had my first ACL surgery, which was three and a half years ago, I want to say I had that. They did so they took part of my hamstring to fix or to sort of graft in, and 3.5 years now, knee is good. The hamstring is still an issue for me, and I'm assuming that sort of replicates a full tear of the hamstring, because I think they take a chunk out of the hamstring. It wasn't really explained to me. It was sort of, they said, this is probably our option. I said, just do what you have to do. I'm not an elite athlete, but I still, when I go and try and do any sort of activity now, if I haven't done anything for a while, my knee feels absolutely fine, but I still notice in my hamstring, it feels like a really bad cramp, or it feels very tight. So as we transition into knees, and I want to focus more on meniscus injuries, but for people that haven't had ACL surgery, or don't, and you wouldn't know anything about it if you haven't had it, does that sort of replicate, I guess, a full hamstring tear, or is it a bit different because they're actually taking part of the hamstring out?
Yeah, it's a little bit different, because you're talking about potentially, when they're doing a graft, they're taking a very specific part, specifically of the tendon, to create that graft for what's going to be your new ACL. So there are a couple locations where doctors can harvest that graft. They can do a patellar tendon graft, where the tendon on the front of your kneecap, they can take a tendon there. Wherever they take a very small piece of the tendon to use as the graft. The tears usually don't happen like that. Either the tendon tears all the way through, or the muscle is across multiple muscles. And that's another thing with the hamstring is also a muscle group. It's not an isolated muscle. So we're talking about the biceps femoris. We're talking about the semimembranosus, semitendinosus. So three different muscles. Location is key. That's kind of the thing I try to convey to people a lot, is injuries are a lot like real estate, and it's true for meniscus injuries. I know we're going to talk about those. It's all about location, and location dictates so much of what's going on in terms of recovery and long-term and future risk.
Meniscus injuries. All right. So I can talk to these as well, because I had one of these when I had my second ACL tear in March this year. So I'm 6-7 months removed from surgery, and ACL feels good. And this time I had a graft. So I had a donor ACL rather than the hamstring. And that was from the previous one. I knew my hamstring was still bothering me. So I said, sure, I'm happy to have someone else's ACL inside me, and it's been fine. It's the meniscus injury that's sort of, I guess, in the back of my mind and seems to be more of an issue. I've never had a meniscus injury before, but here are the different tears, and this is basically what was shown to me when I went in, saw my surgeon. I knew all about the ACL, but he talked about the meniscus. So I had a bucket handle tear in my meniscus, and it was basically the whole way around. So almost, I guess, what you can see in this image here. And he was very honest with me. He said, we will have a look and see if we can stitch it up and fix it. Chances are we can't. And that was to do with no blood flow or not a lot of blood flow to that area. And sure enough, when I came out of the surgery, they said we couldn't repair it. We just had to remove it. So I guess just talk a little bit to meniscus injuries, because Domantas Sabonis, mid last week, was ruled out with a partial meniscus tear. Joel Embiid has had meniscus injuries. I feel like Zion had a meniscus injury early in his career. That was the one that cost him a little bit of time. So people who, again, if you haven't had a meniscus injury, you wouldn't really know what are the options and why isn't it just fixed up, and if it's removed. And that's where I think I'm feeling it, is that basically I've had one side of the meniscus removed. And so I'm aware in my mind that there's no shock absorption in there or reduced shock absorption. So with a meniscus injury like Domantas Sabonis, we'll use him because it's a fresh example. What would he would have had it removed? Would he have had it fixed? I mean, you may not know, but what are the options?
So back to my location, they're not going to necessarily know exactly what they can do, kind of like with you, until they get in there for sure. They can have an idea, but they've got to see the extent. For in your case, the bucket handle tear, that means the piece of cartilage actually folded up like the handle of a bucket or a pail. So it folds up and oftentimes catches, acts as a door jamb in the knee, and that's why it can be problematic and very painful as well. So let's start with some just basic anatomy with what the meniscus are. So there's two discs in your knee, in each knee, the medial and lateral menisci, and they are the shock absorbers of your knee. They prevent the femur, the upper leg bone, from being bone on bone for the top of our tibia, our lower shin bone. Mm-hmm. And they sit in between those two and act as a buffer, and again, absorb shock placed on and through the knee. But the positioning can make them vulnerable, especially with twisting. So the big femoral condyles can kind of pinch that meniscus and cause it to tear, break off a small piece on the peripheral. It all depends on kind of the pattern in which the injury occurred. So next thing we have to focus on in regards to the injury itself is where did the tear occur? You mentioned this earlier, but certain sections of the meniscus are very, very well vascularized. Others are not. And if they've got a decent blood supply, that does make it a little bit more conducive to a true repair versus a removal. But the location of the tear influences and dictates what the surgeon is able to do. Ideally, you have a repair. They go in and they stitch together the cartilage and they repair it because that preserves the cartilage in your knee. But in most cases, this isn't possible. It's got to be in a very specific location, in a specific pattern. So in certain patterns, like we're looking at this image here, you may not even be able to repair it if it's like a flap tear. You know, it might not be able to be anchored down and resutured, or a complex tear. A little horizontal tear, maybe you can do a little stitch. But again, it has to be in a specific location for a true repair to be carried out. If it is carried out, if a true repair is performed, the time lost in recovery is extended because you can, you're often non-weight bearing for a certain specific amount of time to allow the new sutures to heal. We saw this in a guy like Russell Westbrook several years ago. He had a repair versus a removal. There's no guarantee he won't have problems down the road. I think Westbrook's case, he ended up having a secondary surgery to address a suture in the meniscus. But at the end of the day, it preserves the cartilage and helps reduce the chance of something like osteoarthritis or other issues down the road. A meniscectomy or removal, or even just a partial meniscectomy, they don't necessarily take out the whole meniscus. We don't really do that anymore. We try to just take out the area of concern. If it's a little tear on the peripheral of the disc, it can be taken out. You may not even notice that it was gone, but if it's a more complex tear or a bigger chunk of the cartilage needs to be removed, now you've taken out some of the cartilage, you're more likely to increase the chances of future osteoarthritis, future problems down the road. However, the recovery post-surgery is much, much quicker, often measured in weeks, not months. So you're oftentimes players that are potentially asymptomatic may not even have the surgery. If you think about last year, Jaylen Brown played through a partial meniscus tear for a prolonged period of time before addressing it in the offseason. So it really just depends on, are there any associated symptoms and where is the tear actually occurring? And that's going to dictate treatment, which is going to dictate time lost. So it's kind of this cascade of events all based on location.
Yeah. And so we would, based on sort of that thinking, we would assume here that Domantas Sabonis is having the removal. He's having, if they've said 4 weeks, and if he is back in 4 weeks, that because he wouldn't be returning if he'd had the full surgery to repair it in 4 weeks.
Correct. And I actually haven't even heard he's had surgery yet. I don't know if that's the case. I've just, I don't think there's been confirmation there either. They might just be hoping with something like a PRP injection or the associated symptoms to the meniscus tear calm down and allow him to return to play before potential surgery. So a non-surgical route is possible. It would just depend on the associated symptoms. So I think we're going to hear more of details, hopefully something official from the Kings if surgery is warranted, what that looks like. But if they come out and they say they expect him to return this season, it's likely a meniscectomy. If they say he's lost for the year or it's going to be 4 to 6 months, we're looking at more than likely a repair.
Now, obviously, for me, Meniscus and Joel Embiid go in the same sentence, and we don't know what's happened exactly with his knee and that sort of thing, but he's had, from what I understand, he's had at least a couple of these surgeries where they've removed part of the meniscus. When I spoke to my surgeon, and obviously I'm not even close to an elite athlete or anything like that, but I questioned meniscus replacement. So I asked, is that an option? Is that something that can be done? And he sort of said, not really, not at the moment. Is that, I guess, because I'm thinking these are higher level athletes with the top doctors and surgeons and that sort of thing, is that something that anyone ever has done, or is it moving towards being an option in the future, or is it simply not able to be done?
So Embiid has had a history of meniscus issues. He's had 2 surgeries on the left knee and 1 on the right. And he might not have actually had surgery on the right. He had just had the meniscus, lateral meniscus tear. The left knee has been the bigger problem. The right knee is the current issue right now. So, the big thing is we've had some guys start to do some transplants. It's difficult, and I still think we're a ways away from doing it. I believe, if I'm gonna look, let me see if I can pull this up real quick, going through my database here. Lonzo Ball did have a cartilage transplant, so he's one of the first ones that I can think of. I believe Tyreek Evans he had an Oates procedure, I believe. I'm trying to remember exactly what he had a osteochondral autograft. So it's a little bit different than like a true meniscus, but we're talking about repairing areas of either in the same region in that trochlear surface or around the meniscus too. So, there haven't been many high profile athletes that have truly been able to successfully come back from a meniscus tear and then have a subsequent transplant. So I just don't think we're there yet. Down the road, sure, if the technique improves and it allows, I think the big thing there is the associated recovery. And, if you're going to miss a year or 2, is that going to be something that's necessarily feasible or plausible for you where you are in your career, or where the team is, and those kinds of things. And in both those guys took significant times off when they did have that procedure, and then eventually returned, and again, had to have things controlled in the case of Lonzo Ball and carefully monitored moving forward.
Yeah, he's back playing, but he's certainly not the player he was. He's never going to get back to that. And injury management is something that's going to be associated with him, I think, for the rest of his career. But still good to see him out there on the floor. So, okay, I said I'd take about half an hour of your time, and we're at 29 minutes and 50 seconds. So I'll let you get back to things. Quickly let people know where to find you and find all of your stuff that you do.
They can find me on any of the socials at In Street Clothes. Like when a player's hurt, he's In Street Clothes. I run InStreetClothes.com, which I keep up to date with the player, the team evaluations with the medical staff, so you can see where your team ranked previous season. And then, always find me as the injury analyst over at RotoWire, covering all the major sports. So happy to pass along any information I can when I get it, and know that NBA injuries are my thing, man. That's if you're looking for any up-to-date stuff on NBA injuries, I'm your guy.
And there's plenty of those. A lot of players, a lot of injuries, unfortunately, but it's part of it, isn't it? Thanks again for jumping on. I'll get you on at some point again later in the season. I know finding time is tricky, but we'll get there. A reminder for everyone to go and subscribe to the YouTube channel, go and download the audio versions of this show as well. Thank you, everyone, for joining me. I'm Adam King. He is Jeff Stotts. This has been Stuff It, a fantasy basketball podcast. We are done.